Good morning, everyone, and welcome to the 2021 Roland B. Scott Symposium. This Howard University event occurs in May every other year. This is our first time presenting it virtually. Please make sure you explore the Whova page and the phone app for the agenda, networking, exhibitor booths, community chat boards, articles, and more. I've already seen a lot of people on the board, so definitely check it out. The entire symposium will be available on our webpage, ronapediatricfund.org, shortly after the event. Feel free to chat in your questions and comments through the chat functions in each session. Each session will be set up as its own webinar, so you will need to go ahead and click on the next session's webinar once your session ends. We will also have some entertainment during lunch. So grab your food and come on back and meet some of our artists. You will receive an evaluation at the end of the event by your email. So if everyone can take time to fill that out, we would really appreciate it. I would like to thank the planning committee for helping with this event. I was just gonna show the slide real quick. So this is our planning committee. They were instrumental in helping pull this whole event together. We do have posted the slide as a photo and as a document on the Whova site if you want to take a closer look. All right, we have a full day planned, so we do want to get started right away. After this, we're going to welcome the Reverend Michael Dickerson, who's the chaplain of Howard University. He's going to give our invocation. He will be followed by some more information about Dr. Roland B. Scott from the director of the Center for Sickle Cell Disease here at Howard, Dr. James Taylor, and he has a guest with him from the American Academy of Pediatrics, Dr. Sarah Goza. And at the end of the session, he was having a little technical difficulties, but we're hoping to have Dr. Rana to also greet you and present our first round of awards. We hope you really enjoy this interactive and thought-provoking event. Thank you.
Hello. Pastoral Care Services takes this honor in giving the opening invocation to such a prestigious event, the Roland B. Scott Symposium on Sickle Cell, an annual event that touches the hearts of many. We thank the organizers who work tirelessly to bring an amazing program each year. And although we are virtual, we know the power of the God we serve, and that those he intends to reach, he will. Let us pray. Our Father and our God, our provider, our sustainer, and our helper, and our hope. We come today thanking you for another opportunity to shed light on a disease that affects so many, however, does not get the exposure. So as we continue to sound the alarm, we thank you for the platform. We ask that each presenter is guided by your heart, and that is the heart of love. We ask that you continue to bless all those that are affected by this disease. And we thank you for the cure. Bless the caretakers, the families, the doctors. We pray now for the resources to come. And we give your name praise for all that you're going to do. As we continue to open our hearts and our minds to give the service that is needed for these individuals, we ask that you open our hearts, Father, that we do not hold anything against them. We come against the spirit of stigmatism. We ask that you bless us, Father, that we see each and every person that we touch as you see them, and that is your child. We give your name praise for this day, and we ask that you continue to bless us. Amen and amen. Thanks again for allowing Pastoral Care to be a part of this program. As we said earlier, we don't take it lightly, and we thank God for the opportunity. God bless.
Hi, my name is London Nichols, and I have sickle cell disease. I would like to welcome you to come to the 2021 Roland B. Scott Symposium. Thank you.
Hi, My name is Ismail Diallo, a teen currently living with sickle cell disease. Welcome to the Roland B. Scott Symposium.
I'm Dr. James Taylor. I'm the director of the Center for Sickle Cell Disease, a first position once held by Roland B. Scott, the founding director of the center. I'm going to give you a brief overview of his life, as I've been at Howard for the last few years, but working with Howard University for the last 20. I've come to know a great deal of history about sickle cell, and especially about Dr. Scott, and the things that we've uncovered to remind ourselves of how great this man was is really enlightening. So as many of you know, sickle cell disease is a devastating disease that was first described in 1910. Prior to that time, it wasn't known. It was described by a man, James B. Herrick, in a hospital that no longer exists on State Street in Chicago. The history really gets interesting in the 30s and the 40s with Roland B. Scott. He was born in 1909 in Houston, Texas. He came to Howard University, received his undergraduate degree, and importantly, in 1934, graduated with an MD degree. He went to Chicago because in those days, graduate medical education in pediatrics was segregated. He wound up on the south side of Chicago and followed up with a little bit of immunology training at the University of Chicago. He returned to Howard University, joining the Department of Medicine, where pediatrics was actually a division at the time. He was one of the first pediatricians, African-American pediatricians, to pass his pediatric board exam, and then launched an effort to join the American Academy of Pediatrics, becoming a fellow. Board certification is required, etc. This took a prolonged period of time. I thought it was only 2 applications. In fact, it was between 1939 and 1945, overlapping with the Second World War. So while the rest of the country was fighting a global war, Dr. Scott was also fighting his own war. He was ultimately successful in 1945, becoming a fellow, and then shortly after that became the chair of pediatrics, a freestanding department at Howard University. I really believe he is the first African-American pediatric department chair. Illustrated here in this photograph is a picture of the Department of Pediatrics in 1948, taken from the Saturday Evening Post. This is Dr. Sarah Kessler, Dr. Blanche Bourne, and Dr. Scott with a young child. The Saturday Evening Post was doing an article on the color line of medicine, highlighting health disparities and the role that HBCUs, which at the time in 1948 were the only places where African Americans could train as physicians. It is not lost upon me. I pulled out a letter from to Park J. White from Roland B. Scott after his election. Nobody stands alone. Park J. White was a pediatrician in St. Louis, Missouri, who interestingly trained Blanche Bourne at the Homer G. Phillips Hospital. And he was also instrumental behind the scenes in Dr. Scott's pursuit of fellowship in the American Academy of Pediatrics. So the connections are Blanche Bourne trained at the Homer G. Phillips Hospital in St. Louis, Missouri. This was the largest training hospital for African Americans west of the Mississippi from the 30s through the 70s. Homer G. Phillips, in fact, was a lawyer who went to Howard University Law School, and he advocated for a hospital in North St. Louis to care for this, at the time, segregated African American community. He was actually assassinated in the early 30s in St. Louis because of this pursuit, and to heal the community, they established a hospital in his name, in his vision, in North St. Louis. Again, this is where Blanche Bourne trained in pediatrics, then returning to Howard University and joining the Department of Pediatrics. Well, so Dr. Scott was amazing in that he recognized sickle cell was a problem in Washington, D.C. He published one of the first newborn screening studies in June 1948. This is before we had diagnostic tests for sickle cell disease. He used the Amel test, which is something that's used in the developing world today. And he provided the first data on the incidence of the sickle trait early in life, really foreshadowing in 1948 something that we do every day today in pediatrics, and that is newborn screening. In 1949, a year after Dr. Scott's first publication, Linus Pauling discovered sickle hemoglobin and coined the term molecular disease. This was very important in the development of sickle cell disease because science fell in love with the disease. They did not fall in love with the patients. So between 1950 and 1972, there was almost no NIH funding to study this disease. And again, science fell in love with the molecular mechanism, but little was done for therapy. Dr. Scott spent most of his career lobbying tirelessly to establish some type of research infrastructure for sickle cell disease. He published this, not surprisingly, in the Journal of the National Medical Association, and he spent a lot of time on Capitol Hill and with the White House in the early 70s, lobbying for the National Sickle Cell Control Act. So this was Public Law 92-294. It was passed on May 16, 1972. The first press release related to sickle cell disease ever in the history of the United States. In the history of the US, there have only been 3 presidential White House press releases just describing how common the disease was and that many were crippled long before death and some died prematurely. This established 10 sickle cell centers across the country, of which Dr. Scott headed one of them, all funded by the National Institutes of Health. In 1975, he was back before the Senate Health Subcommittee testifying on the need for expanding the number of sickle cell centers across the nation. And one of the things that he pulled out in 1974, $40 million had been appropriated for sickle cell research, but in fact, the NIH only spent $16 million. This is all his testimony was published in the 70s, and they did expand to 15 centers. In 2020, in September, the American Academy of Pediatrics, in response to recent national events, published a paper on truth, reconciliation, and transformation, and really highlighting the legacy of not only Roland B. Scott, but his senior physician at Howard University, Dr. Alonzo de Great Smith. The 2 of these gentlemen were the first African-American fellows of the American Academy of Pediatrics. They had to apply multiple times and really were trailblazers in this field. So with that, I just wanted to turn it over to Dr. Goza, but the accomplishments of Roland B. Scott are not only becoming the first African-American fellow of the American Academy of Pediatrics, just demonstrating tremendous perseverance and persistence. He also was the first, I believe, African-American pediatric department chair in 1945. He established one of the first newborn screening studies in 1948, well before we implemented this in the 70s. And he was instrumental in the passage of the National Sickle Cell Control Act in 1972, which led to newborn screening because sickle cell was the first disease that we focused on that. And efforts by Dr. Scott and many of his trainees, many of whom I never met Dr. Scott, led to advances in transfusion medicine, newborn screening for sickle cell disease and other diseases, the natural history of sickle cell disease, and sickle cell pulmonary hypertension. And so with that, I'm very pleased to turn this over to Dr. Sarah Goza, who is the president of the American Academy of Pediatrics.
Thank you, Dr. Taylor. And I will correct that. I'm the immediate past president of the American Academy of Pediatrics, but I'm really honored to be part of the Roland B. Scott Symposium and humbled to pay tribute to the man for whom the symposium is named. In his lifetime, Dr. Scott was a groundbreaking researcher who put sickle cell disease on the map, just like you said. He is an important part of medical and pediatric history, but also something larger. Without him, the story of medicine, the American Academy of Pediatrics, and our nation would not be the same. Dr. Roland Boyd Scott and his Howard University of Medicine colleague, Dr. Alonzo de Great Smith, were the American Academy of Pediatrics' first Black members. However, Their experience in attaining membership reveals an AAP executive board that was not immune to racist attitudes and beliefs. Between their initial rejection in 1939 to their eventual acceptance in 1945, Dr. Scott and Smith were made to bear numerous indignities and clear many hurdles, despite being successful clinicians and established leaders in the pediatric academic community. 4 decades later, Dr. Scott would go on to receive the Abraham Jacoby Award, the Academy's highest honor. But it was not until last year that the AAP issued a public apology and began to take those pains of conscience and turn them into plans for action to ensure no pediatrician or child is discriminated against, and to confront bigotry and racism through policy, programs, advocacy, education, community engagement, and broader social change. Dr. Scott continues to inspire us through his genius and perseverance, but also by the boundless compassion he had for the families and children he cared for in his practice, making house calls and scheduling office hours late into the evening to serve those who had few options for receiving care due to racial segregation during the 1940s and 50s. To pursue his calling, Dr. Scott overcame numerous racial barriers, including discrimination in hospitals, medical education, and medical organizations. Where most people would have been frustrated by the difficulty, Dr. Scott triumphed. Along the way, he brought others with him and planted seeds that continue to grow. The American Academy of Pediatrics is indebted to Dr. Scott for all he has done for pediatrics and for children, and grateful for his dignified example, which opened our eyes to the ugly consequences of racism and discrimination and the beauty of grace and compassion. Dr. Scott's courage and resolve helped bring us to this inflection point in our nation's history, and we pledge to preserve his memory and tend the seeds he has planted so that they continue to grow and spread into a world where all children and medical professionals are able to thrive and reach their full potential. Dr. Scott's legacy lives on, and our work continues. The Academy stands with you and behind you as we honor his memory and pursue a brighter future together. Thank you. Was I muted that whole time?
No, you are
Okay.
not.
No.
Betty, where are we headed next?
We are headed to Dr. Rana, hopefully.
Okay.
Dr. Rana, did your video come back?
No, I have no control over video. So
Okay, well, we can hear you.
That sounds wonderful. I think that probably is the best way to go. I just have to sound better than probably I sound, and I'll do my best, huh? And
Okay,
I
but
really,
you can see the slides, right?
I can see the slide, yes.
Okay.
Can you hear?
Yeah, we hear you fine.
Yeah. I just want to start out by truly from the bottom of my heart and with all I have to thank God for this wonderful, wonderful event. It's been 15 years since Dr. Jenkins, that's Renee Jenkins, asked me to start organizing it. It used to be a 45-minute, 1-hour lecture where we honored Dr. Scott and we had one guest lecturer, usually a scientific lecturer, somebody very accomplished. If you see the agenda today, you will see that we are not just talking science or hardcore science or bench science or molecular science. We are talking about human beings. So while we will talk about science, it occupies only a small part of this 6 to 8 hour event. It's not a lecture anymore. It's a participatory conference. And I have to thank Patty, Cynthia, and our team of wonderful people who put this program together. I'm truly, truly appreciative. Patty and Cynthia have been working with me in various capacities for probably 25 years or more. And I truly have to thank God for them. Everything we do as a team, and they make it look so good and so easy by putting in hours and hours of work. The preparation for this event started more than 6 months ago. And I'm just looking at the agenda, it fills my heart. We are talking about taboo subjects like sexuality. We are talking about insurance. We are talking about stigma of pain and stigma of a genetic disease. And we are talking about new treatments for sickle cell disease. But as you go through and as you watch the program, you will see individuals and families living with sickle cell disease are every bit a part of this event, and even more. We would like them to actually take this away from us, will lead us to where we need to go. And London, who opened the session and welcomed you all, she's an outstanding example. London, on her 8th birthday, her mama asked her, London, what do you want to do for your birthday? And she said, I want to have a walk for sickle cell disease to raise funds. And they donated money to run a pediatric fund. And that's why we are able to hold conferences like this. But we are also able to have people like Patty, Cynthia, Zainab, Sahir, and so many others who put this program and many other activities together to serve the community, to educate them, to advocate for them, and to provide platform for the best people who are doing research for sickle cell disease to be able to speak to the community. So I think, and Krish, welcome. Krish will be getting an award later in the evening, and he's one of the keynote speakers. We are so thankful to God for people like that. So I thank God for all the advocates, for all the speakers, for all the wonderful people who organized, to Dr. Taylor and the team at Sickle Cell Center, but also team in pediatrics, our chairman, and of course, Dr. Roland B. Scott, Dr. Castro, Dr. Victor Gaduk, and many others who have led the center and guided it to where it is now, at the forefront of research, at the forefront of advocacy, at the forefront of education, and God willing, it would be a center of excellence for the whole nation to see and to follow in research, advocacy, and education. So I start with some very dear friends to recognize their effort. This is just a minor recognition. This is a minor recognition, but I'm so thankful to these researchers. If I can have the next slide, St. Elmo. Dr. Noure, Dr. Noure, Assalamu alaikum. I miss you so much. If anybody has ever worked with Dr. Noure to conceive, to plan, to design, and to add the methodology section and analysis section, there is no person in the world I know better than Dr. Noure. I mean, this is very serious. This is a thanks from the bottom of our heart. We have planned so many research projects here at Harvard when he was here, and I miss him so dearly for his contribution to our present research and future research. So Dr. Noure, Syed Noure, he is not at Harvard, but we feel his presence through many publications that he continues to produce with Harvard as one of his institutions where he worked. I appreciate his efforts that he did and his efforts that are continuing and contributing to research in sickle cell disease. So Dr. Noure, kudos to you, and we recognize your efforts in research for sickle cell disease. Next. Somebody very close and very dear to all of us, not just me, and Dr. Nehai. It's just absolutely awesome person. We were so thankful to Dr. Gaduk for bringing him here. He has done so much for Harvard and for sickle cell disease, and he continues to do it by bringing in wonderful funding and guiding us all to awesome research, including research to show how trait for sickle cell disease actually is protective not only against malaria, but also HIV, and leading the research center in minority institution, RCMA, and doing some wonderful research in the area of proteomics, but also as a mentor to so many graduate students and mentor to all of us for research. So Dr. Nihai, we recognize your work, and we are so glad you're still part of Harvard community. But as everybody who knows you, you are contributing to work all over the world, mentoring people from Africa and other parts of the world, and mentoring people here. We thank you, and we thank God for you very much. We appreciate you. Next. Now, next is people who silently do behind the scenes so much for people with sickle cell disease, their families, and to promote events like this, to do fundraising. And I recognize, next. Awesome. Beverly Francis Gibson. What an awesome person. She's the executive director of national, she was the executive director of National Alliance on Mental Illness at Howard County. And she is leading, the Sickle Cell Disease Association of America. And we are so proud of her work. Sickle Cell Disease Association of America is a different organization under her leadership, all inclusive, very appealing, online presence, and so much work on the ground, and in holding conferences and doing actual work, and leading us to provide better care for people with sickle cell disease at their home, in the community, and educating the community. We thank you, Beverly, so much. God bless you. Next. Awesome. Ms. Bailey is an MPH. She's at Hopkins, and she's a program coordinator for Sickle Cell Partners and so many other efforts. Her work has managed to affect so many people with sickle cell disease and their families positively, but she also leads us in this collaborative work under synergy. We are part of her program, and we appreciate her leadership in providing and improving care of people with sickle cell disease. We thank you, Ms. Bailey, and appreciate you very much. Next.
I think that's the end of the awards, Dr. Rana. So if you want to wrap it up, we can transition over to the treatment session.
That's awesome. Thank you, Patty. Again, you know, all I have to say is words of gratitude, and I want to thank St. Elmo for organizing this event. Again, I want to thank all the participants. Thank you so much for joining. And hopefully there will be more joining the program. I want to thank all the previous awardees. I can't mention all their names, but
we have a slide later.
Okay, but I think it is important to say that we have recognized Dr. Casala, we have recognized Dr. Goduk, we have recognized Dr. Shu, and many other people who continue to contribute to the cause of sickle cell disease in so many ways. And some of them are like Dr. Darbari. You would be seeing her later in the session on insurance, but these people continue to contribute wonderfully. So Patty, take it away and let me know what I need to do.
Okay, we're just, people can sign into the next webinar, which will be options for therapy. And Dr. Rana, you need to sign into the Zoom for that one separately.
Okay. So I need to leave and rejoin, huh?
Yes, you do.
Thank you so much, Patty.
All right, thank you.